What is osteopathy? At its core, osteopathy is a fairly straightforward concept. It is about aligning your structure so the body can heal itself. It involves three main ideas. The body is a dynamic unit of function. That means everything is interconnected. The body is able to self-heal and self-regulate naturally. And structure governs function, meaning the proper alignment of all layers of structure gives the body the ability to function as it was designed to. Osteopathic practitioners don't consider themselves healers. Instead, they are facilitators of health. They help get your body back to its proper structure so it can do what it is supposed to do. Sometimes with poor posture, age, or injury, your structure can get out of whack and problems can start to happen. But if the structure is aligned, with both hard tissues and soft tissues combined, then the body will take care of itself. One analogy we often use is to think of the body like a house. If you have a house with a crooked foundation, how will that affect everything in it? How will that affect the electrical system, which is like your nerves? What would that do to the plumbing? That's like your lymphatics. What's that going to do to all the air circulation? That's your heart and your lungs. Everything is affected if something is wrong with the foundation. Similarly, in the body, poor structure will have effects everywhere. Align the layers of the structure, and the body will function as it's designed to. Techniques versus principles. First and foremost, osteopathy is a way of thinking, not a way of manipulating. Many modalities use the same techniques: strain, counter-strain, facilitated positional release, muscle energy. So what makes it osteopathic when used by an osteopathic manual practitioner? It's the thinking behind it. The thinking does the assessment. The thinking finds the dysfunction. Then the thinking customizes a treatment for the patient. Osteopathic thinking has its foundation in principles. Combining osteopathic principles with a thorough understanding of anatomy, physiology, and technique, that is osteopathy. Principles are everything. Techniques alone misses the point. The CAO offers the only principles-based program in Canada. Why is this? Over the decades since its inception, osteopathy around the world has been watered down by some into techniques, and in many cases, it doesn't resemble osteopathy at all. The CAO stays true to the original principles of the profession, when osteopathy was incredibly effective. We follow the writings of the founder, Andrew Taylor Still, and the writings of his early graduates. While some schools base their entire curriculum on memorizing techniques for each part of the body, the CAO goes much deeper and teaches the osteopathic principles that govern technique and treatment. This is important because if a practitioner understands the principles of osteopathy and has a full understanding of the anatomy and physiology, they don't need to memorize techniques at all, because they can intuitively create techniques on the fly based on their understanding. This makes for far better patient outcomes because the technique and treatment is customized for the patient in the moment. An analogy that we like to use is the chef versus the short order cook. An osteopathic practitioner who only knows techniques is like a short order cook. They always have to work from their recipes and are limited by them. An osteopathic practitioner who understands the principles is like a chef. Sure, they know lots of recipes too, but their education has developed them further. They understand how the ingredients work together, the chemistry and the physics of the cooking principles, and this allows them to not only customize dishes for the person they are cooking for, but also to create new dishes that have never existed before. This is our goal for CAO grads, to have the expertise and skill to treat patients in a dynamic and customized way. This is why the training is so demanding. It takes a lot of education, training, and practice to become a skilled and successful osteopathic manual practitioner.
Sagittal plane, you say backwards and medial. They've got just a little bit of an angle like this, but they're definitely facing backwards and medial. Again, just think about how those planes are going to move on top of each other. That's how you have to see it in your head. That's why you want that three-dimensional picture in your mind as best as possible.
And make you feel better about what you're doing, and I have no problem doing that. And I'm always available too. You can meet with me anytime you like. But I'd like to talk to you about how you prepare for that day mentally today, a little bit anyhow, and how you see yourself going into that room.
The CAO curriculum aims to meet or exceed the international education standards in osteopathy. But it's the exceptional quality and dedication of our teaching staff that brings this curriculum to life in the classroom.
I know that students come from different backgrounds, have different learning styles, and I try very hard to help people with each of their individual styles. I think this is true with all of the people that I've dealt with here, that they're extremely willing to spend extra time and find innovative ways of helping students achieve their goals.
What sets the CAO curriculum apart from other schools is that you are not given a recipe book. There's no answer book that's going to tell you how to do or how to treat a specific situation or condition you're treating people. And you are equipped with all the knowledge you're going to need, all the principles, and that takes a very long time to understand what that actually means. But once you get it, nothing that comes in the door is a challenge that's going to be insurmountable.
Interactive group tutorial sessions and one-on-one tutoring for students both ensure that all students harness a mastery of the material and no one is left behind. And our online education portal provides students with 24-hour learning resources.
The students that graduate from the CAO are very successful right away. It would seem the majority of the class I graduated with are running very busy practices. They have little issue dealing with more complex patients right away, which is really unheard of in the manual therapy field. You just don't get that instant success. And they really enjoy their work too, which I think is of equal importance to just being simply busy.
The CAO helped me with perspective. Rather than having the same challenge and approaching it the same way, the CAO really taught me to approach maybe that same problem, but from many different ways, many different angles, which I think was lacking in my previous education.
Our graduates leave the CAO with a depth and breadth of knowledge unmatched by other schools, allowing them to effectively diagnose and treat in professional osteopathic practice.
We can discuss our problem-based learning, the way we choose our professors, the way we choose our teachers, but at the end of the day, it all culminates into a successful clinical practice. That's what the CAO is all about.